Welcome to the BMAT Learning video, the bedside mobility assessment tool for nurses. BMAT was validated as the Banner Mobility Assessment Tool by Banner Health. It was originally derived from the Quick 3 and Egress tests. It is also referred to as the Bedside Mobility Assessment Tool. Prior to beginning the BMAT, you should ensure your patient is able to follow directions, does not have strict bed rest or bilateral non-weight-bearing orders, and passes physiologic screening for early mobility, typically only for the ICU. The BMAT has 4 steps: sit and shake, stretch and point, stand, and walk. Assessment Level 1, sit and shake. First, ask your patient to come to a seated position at the edge of bed. Your patient may use the side rails, but do not offer any physical assistance. Next, extend your hand to shake hands with the patient. Force your patient to reach across his or her midline. Patients unable to complete the tasks of Assessment Level 1 are considered Mobility Level 1. Consider using some of the equipment seen here to help move and mobilize your patients. Patients able to complete the tasks of Assessment Level 1 move on to Assessment Level 2, stretch and point. Stretch and point assesses the patient's quad strength and ability to attempt to stand. Ask your patient to stretch and point, but remember, only assess the leg your patient is intending to stand on. Assess both if the patient is intending to stand on both legs. However, if your patient has an amputation or limited weight bearing on one side, only measure the side they intend to stand on. Patients unable to complete the tasks of Assessment Level 2 are considered Mobility Level 2. Consider using some of these devices to help move and mobilize your patients. Always remember to consider your patient's weight-bearing abilities. If your patient is able to complete the tasks of Assessment Level 2, move on to Assessment Level 3, Stand. The stand portion of the assessment tests the patient's ability to come to a standing position and maintain standing for 5 seconds. Remember to provide assistive device such as walker, cane, or crutches if needed. Ask your patient to come to a standing position, holding on to the bed rail if needed. Then count to 5 to assess your patient's ability to stand. At this point, there may be 2 kinds of Mobility Level 3 patients: those who fail Assessment Level 3 and those who have assistive equipment needs. Patients needing assistive devices should be considered Mobility Level 3. This will help ensure patient safety. It will help alert staff to the need for assistance to provide the patient with assistive device if it is out of reach, and typically these are higher fall risk patients. Patients who fail Assessment Level 3 are considered Mobility Level 3. Consider the use of these devices to help move and mobilize your patient. Patients who use an assistive device such as a slide board, walker, cane, or crutches are considered Mobility Level 3. Ensure that these devices are within reach for your patient. If your patient was able to complete the tasks of Assessment Level 3, move on to Assessment Level 4, Walk. Even if your patient is using an assistive device, it is recommended to continue the assessment. Obtain any assistive device needed before you begin. Next, ask your patient to take a step forward, then a step back, repeating with each side. Have her shift her weight to the forward foot, then back. If your patient demonstrates stability, you may ask your patient to take a few steps away from the bed, although this is not required for the BMAT. Remember, regardless of your patient's performance, this patient is still considered Mobility Level 3, although this patient may only need to be provided with his or her assistive device. For patients not requiring the use of an assistive device, ask your patient to march in place, lifting one foot then the other, ensuring the foot can clear the ground. Next, ask your patient to take a step forward, then a step back, repeating with each side. Have her shift her weight to the forward foot, then back. Assessment Level 4, or Walk, will help you assess your patient for steadiness standing and walking. Ensure that your patient is stable on his or her feet before you ask him to take a step. Some conditions, especially neurological conditions, can cause taking forward and backward steps to be difficult. Ensure safety and guide the patient back to edge of bed if the patient appears unstable. Patients unable to complete the tasks of Assessment Level 4 are considered Mobility Level 3. Patients who pass Assessment Level 4 are considered Mobility Level 4. Failing Assessment Level 4 also indicates the need for a more in-depth physical therapy assessment. Refer to your physical therapy department if there are any concerns. Patients who passed Assessment Level 4 are considered Mobility Level 4. Remind patients to call, don't fall. These patients should not require the use of assistive equipment. However, if these patients are weak and unable to assist or have fallen, consider the use of safe patient handling equipment to assist the patient. We will now show you the full BMAT assessment start to finish. However, it is not intended to be a standalone assessment. It is intended to be integrated into your daily head-to-toe nursing assessment. Before you begin, always ensure your patient is able to follow directions. First, ask the patient to come to a seated position. They may use the side rail, but you should not offer manual assistance. Next, ask your patient to reach across midline and shake your hand, measuring for balance. Next is stretch and point. Ask your patient to extend her leg, pointing her foot forward, and then stretching her foot back to flex. Next, ask your patient to come to a standing position. They may push off the bed or hold on to the handrail if needed. Then, count to 5 to assess your patient's ability to maintain standing. Next, ask your patient to march in place. Demonstrate the activity if needed, and ensure your patient is able to clear each foot from the floor. Next, ask your patient to take a step forward, then a step back, repeating with each side. Have her shift her weight to the forward foot, then back. Once the assessment is complete, spend some time on patient teach-back. Describe to the patient their level of mobility and ask them to verbalize their understanding of any assistive devices needed. And as always, remind the patient to always call, don't fall. For any questions or concerns related to safe patient handling and mobility or the BMAT assessment, please contact a member of the UCLA U Moves Early Mobility Program, including your unit-based mobility champion, safe patient handling champion, unit manager, or safe patient handling coordinator.